When it comes to their kid, parents have a lot of worries. They have a lot on their plate. Worrying about their child's happiness, safety, and well-being is a never-ending job. Worrying about your kids fitting into school, making new friends, their grades, sleeping, a well-balanced diet. No wonder parents are burning the candles at both ends. With craniofacial development, any discrepancies can lead to restricted airflow, which actually affects their sleep and their behavior. The journey to maintaining your child's dental health actually starts from infancy, the first 1,000 days, with how we feed them, how they breathe, and how they sleep. Doctor checkups, dental checkup, intervention, habits, all of these things are essential to meeting our child's needs. Maslow's theory of hierarchy says that we need our basic needs met. So all of these are going to be essential for them to thrive, not just survive. Starting with nursing, breastfeeding, bottle feeding. How does the bottle fit the mouth? Proper bottle fit. Are they using their tongue versus just their cheeks if they're bottle feed? Not leaning them back so the fluid doesn't get in their ears. Reducing sugar, having a balanced diet, getting plenty of exercise, getting plenty of sleep, and so much that we have to think about. All of these play a crucial role in our child's health and well-being. Parents have been reaching out to me with various concerns, from cavities, teething, misaligned teeth, thumb-sucking habits, finger-sucking habits, bedwetting, ADHD, tossing and turning in their sleep, dark circles under their eyes, night terrors. Each of these topics are crucial and probably need dedicated attention. But today we're going to address the common questions that parents have that can help you have worry-free care for your child. Who do you go to? Who do you trust when your child has an issue? There are so many people that have so many opinions. It's hard to know who to believe. Things have evolved, and we're in an age of prevention where we can be proactive that will save us time, money, and most importantly, assure our children's health. Every decision has a cost, whether it's time, money, or health. The ball is in your court. What will you choose for your child? For more resources, you can join Healthy Mouth Moms, where I have Checkup from the Neck Up, where we talk about these things every week and I answer your questions more one-on-one. Or you can continue to watch these videos. What is happening with your kids? What should you look for? I wish I had known this stuff. Craniofacial development is interconnected with the bones, the skull. Children with airways like mouth breathing, enlarged tonsils, adenoids may experience reduced airflow, leading to sleep problems, behavioral problems, sleep apnea, even eating issues. They can also have ear issues and need tubes in their ears, as it's crucial to be vigilant of any airway problems that you see. Consult your dentist, pediatrician, ENT, or any other specialist as necessary, or you can contact me. There's an important point to consider when it comes to feeding that most parents don't even know about. Jaw development reduces your risk of crowded teeth, misaligned teeth, airway issues. Feeding your child solid foods that they have to chew more, as opposed to sugary, soft snacks, is going to help give them nutrients rich in the vitamins that they need. Once they are 7 to 8 years old, they have met 80% of their growth and development. Most orthodontists will tell you to wait until baby teeth come out and then see an orthodontist. But if you look at what's happening in your kid's mouth before that first 1,000 days, there are things that you can do to help prevent some of these things from happening. Making sure their tongue is up. That's where myofunctional therapy comes in. Myofunctional therapy has 4 goals. Tongue in the roof of your mouth, lips together, breathe through your nose, and correct swallow. When you have all of these things and your kids are breathing through their nose, they will sleep better. They will breathe better. They won't be kicked out of their circadian rhythm. They'll get the good rest and repair that they need. I had no idea my daughter's bedwetting was connected to what was going on in her mouth, her tongue, and her facial muscles. I wish I had known that. They didn't teach us this in school. I didn't learn this stuff until she was 12 or 13. By then, she had most of her growth and development, and she had already worn braces 3 times. She's 18 and still in braces, trying to get her alignment correct because I didn't know what I didn't know. I didn't know that her tongue was an issue. So it's important that we get this information out there. We know what to look for. We're also going to talk about pH of your mouth. What can parents do about the pH? So cavities happen when the pH drops below 6.5. If your child is having cavities, they probably have a pH problem more than they have an oral hygiene problem. So oral hygiene is just a piece of the puzzle. Brushing morning and night is going to disrupt that bacteria. But if you're brushing morning and night and your kids are still getting cavities and other kids in the family are not getting cavities, it could be coming from their stomach. It could be created from you're eating more sugary foods, you're having more acids, and that bacteria could be weakening the enamel. So when you have plaque on your teeth and you don't disrupt it, when you feed the plaque, it poops an acid. And that's what causes a cavity. And I've had a lot of people tell me that soft teeth runs in their family. You might be surprised to find out that enamel is the hardest surface in your body. There is something called enamelgenesis imperfecta that can create teeth that are more prone to cavities, but not very many people have that. So it's more of an epigenetic, where it's habits, genetics, what we're feeding them. So when soft teeth runs in their family, it's probably more acidity runs in their family, or their habits are not so good, or you're eating more acidic foods rather than healthier foods. It has to do more with an imbalance, and you need to get back into balance. So encouraging water consumption when you can't brush your teeth is going to be good, because water generally has a neutral pH of 7.0. There are some waters that do not. You can actually get pH strips where you spit on the test and it tells you what's happening in your mouth. Then you can compare it to the chart. Where you're in more of the yellow section, then you're more acidic. If you're in the blue, green, or purple, you're more alkaline. So if you have a more acidic environment, you're going to need to eat more alkaline foods. If you're in a more alkaline environment, you're not going to have as many cavities. If your child is more in the yellow environment, they're going to get more cavities. So again, it has to do more with the acid environment that's in your body and in your mouth. Any disease in the body does not survive if you have a pH that's balanced. If you have a low pH, most diseases come from an acidic environment in the body and in the mouth. So let's talk about signs to look for and why you might need an orthodontist. Baby teeth should ideally be able to fit a nickel between each tooth. There should be spaces between the teeth. They should not touch. If you have a child that looks like this, then they're probably going to have airway issues, need tubes in their ears, have ear problems, have an airway problem. They could have swollen adenoids. They could have swollen tonsils. These are all things to look for in your child. If your kids are little and their teeth are touching, there are different appliances that you can get to help this when they're little, to use their growth and development. If you're not sure who to look for, click the link below and schedule a 10-minute call with me, and I can get you to who you need to help intervene. So we want them to keep their lips together, to chew more. And again, some of these appliances will help use their growth and development. So maybe they won't need orthodontics when they get older, or they might just need minor orthodontics. If you wait till they're older, they might need a palatal expansion where you have to crank that open. If you see crooked teeth, misaligned teeth, difficulty chewing, difficulty swallowing, difficulty with speech, you might want to seek an airway orthodontist or a myofunctional therapist. Finding these things early and using prevention can guide proper craniofacial development instead of fixing it later. It's great to know that prevention can make a difference, and it can if you get to it early enough. Dental hygiene, toothbrushing, flossing, pH, tooth alignment, diet, exercise, thumb sucking, speech development, where is your tongue, dental anxiety, fear, breathing. These are all things that parents need to look for and are important for a lifetime of healthy smiles and overall well-being with your children. So here are some key takeaways. Start dental care early. As soon as the first tooth appears, even before, you should wipe out your children's mouth. Look for these signs: feeding issues, swallowing issues, speech issues, crowded teeth, baby teeth that touch. Investing in your child's oral care now can lead to beautiful smiles and overall well-being. The content provided here is for informational purposes only, and it's not intended to be a substitute for professional medical or dental advice. Always consult a qualified healthcare professional and personalize your care, because we are all different, and what's going on functionally in our mouth is going to be different from person to person. Parents' primary goal is to ensure the well-being of their child, which requires a lot of attention and care, and it can be overwhelming knowing what to look for and who to trust. If you found this helpful, please share. Remember, your child's oral care can lead to beautiful smiles and overall well-being. If you have questions or there's something that I didn't answer, put a comment below or click the link below and schedule a free 10-minute call with me, and we can talk about your specific individual concerns that you have for your child or family and action steps that you can take to lead them in the direction of a healthy body and a healthy life. As always, a healthy mouth is a healthy body and a happy, healthy life. Thanks for watching. Till next time.